Hello and welcome to another series. Today's topic is urinary tract infections. I am Dr. Susan Raschal, a.k.a. Dr. Seuss, and this is my esteemed colleague, Dr. Rena Azar, and she is going to take the lead on urinary tract infections, which we also refer to as UTIs.
That's right. So most people know what a UTI is, a urinary tract infection. It's just in general, it's an infection of our urinary tract. So what is the urinary tract? Susan has a really complex diagram here that I drew out this morning.
She's also an artist.
Yeah, well, it's not really very evident here, but here are the kidneys. The kidneys are the organs that siphon or filter our blood to pull out byproducts that our body has made. And those products, if they build up, are toxic. And we all know that if your kidneys don't work, you have to get dialysis because our bodies need to have those toxins removed. That is the job of the kidneys. They collect those toxins and transport it in the urine, down the ureters, into the bladder.
One of the things that I want to mention is that you don't need both kidneys. You only need one kidney to work excellently to take care of the entire body. So only one kidney is used. The other thing I should mention is that there is another treatment, and it is a kidney transplant.
That's absolutely right. So these are valuable little guys. So the question is, what is a urinary tract infection? I get a lot of people that come in and say, I have a bladder infection, I have a kidney infection. So I want to go over that a little bit more so people have a better understanding of the difference between these and how to differentiate symptomatically. This is the urinary tract system, okay? It's a system of things that work together. So this is what we call the upper tract. It's deep in your body. It's the kidneys. It's the upper tract, okay? And it's the filtering part of the system. And then this is the collecting part of the system. It collects it and it stores it in the bladder. And these components are referred to once again as upper tract and lower tract. So the number one way that people get infections is ascension or crawling up with the bacteria from the genital area to the tube up into the bladder. So most people that get bladder or kidney infections, that's how the infection began. So most people will present at a time where they're feeling symptoms related to the bladder infection. If the infection's been going on a long time, then it can ascend or crawl on up to the kidneys. So the symptoms between an infection here and an infection that's gone further up here are, you can imagine the difference between just kind of a superficial infection in the storage area versus a systemic infection. A systemic means this infection is deeper inside of your body. And so the symptoms that people present with when the bladder is infected, and only the bladder is infected, are urinary frequency, urinary urgency, pain with urination, suprapubic pressure, suprapubic pain and pressure.
Where is the suprapubic area?
That is right above this hard pubic bone, right dead middle of the center here, as you press down very low over the top of that bone. That's where the bladder is located, and that's what will hurt when you have a bladder infection. If the bacteria crawl all the way up the tubes, people start getting some flank, what we call flank pain. This is the flank area right here. And so they'll start getting some flank pain. We're going to go over flank pain, kidney stones, etc. at another session, but for now, this is where the tubes travel up, and now when the infection gets up higher in the kidneys, you have what we call costovertebral angle tenderness. That is a region in the back, right about here where our kidneys are, okay? Kidneys are back here underneath the rib cage where they can get protected.
So the lower ribs in the back is the area that she's talking about. And frequently with that, a person will have a markedly elevated temperature, 103, 104 degrees, and they don't, it's much worse than just having a urinary tract infection.
A bladder infection, yeah. Any infection in here is called a urinary tract infection. This is bladder infection.
Bladder infection.
This is kidney infection. Yeah. But a urinary tract infection does not differentiate where in the urinary tract that is. So it's helpful for your doctor if they know, did you have a bladder infection or did you have a kidney infection?
And what's the medical term for a kidney infection?
Pyelonephritis. So very few people know that one. Right. But anyway, if you
may hear that term, and that's what they're referring to.
Absolutely.
Is the kidney itself, which can be very severe, especially if it's not treated, because people can develop sepsis from that, and that is a potentially life-threatening condition, which is why it's so important that, again, if you have symptoms, just like Dr. Azar was talking about, symptoms of your bladder, that you get it addressed.
And by the time it gets up into the kidneys, you, like she's already referred to, you'll have systemic symptoms. Now it's not just pain and discomfort and symptoms related to this lower bladder. Now it's aches in your upper back and generalized body aches, nausea, vomiting, fever. If you've got symptoms like that, that is likely an infection that's progressed very significantly. And so you need to get checked out so that we can treat it, because that is an infection that is not likely to go away on its own.
Right.
And just like she said, sepsis, which is infection that's in the blood and therefore can be throughout the body and can cause global organ shutdown. It's very serious if you get septic, because now those infectious cells in here have gotten into your bloodstream, because remember we talked about how these filter the blood, and the infection can crawl in, get into the blood and get throughout the body. That is very serious. So when people have a bladder infection here, do we have to treat it? We do know that people will periodically get bladder infections and have minor symptoms or no symptoms, and their bodies can eradicate that infection. It's very hard for the body to get rid of an infection that's gone from here all the way up here, but symptoms in this area might possibly go away on their own with your own immune system. I think women know that, because frequently they'll say, hey, I started having a little pain with urination, a little frequency, urgency, drank some cranberry juice because they had acidic nature that tends to help us prevent bladder infections from progressing, and lots of fluid, and oftentimes people can eradicate the bladder infection on their own. But if the symptoms persist, surely come in and get treated. We're going to have another series about this, because there are a lot of considerations for bladder infections. And I'm going to make reference to the fact that they can be different kinds of bacteria. It can be different in nature. Like you might get an infection that occurs really regularly. Do we want to consider preventative antibiotics? Do we want to consider giving you an antiseptic for the bladder, which is kind of a soap for the bladder? We have a lot of different treatments for people that get recurrent urinary tract infections, which is going to be a topic that you'll hear in another series about. So hopefully you understand the difference between lower tract and upper tract infections, and the importance of seeking assistance in getting rid of those with your doctor or your nurse practitioner or your PA. Get in, be seen, and don't ignore your body.
That's right. So thank you so much for tuning in, and look forward to seeing you again in our next series.
Mm-hmm.